A very good morning. Today I am going to present a paper titled Novel NDUFV1 Gene Mutation Causing Progressive Optic Neuropathy, a Rare Mitochondrial Complex 1 Disorder. Coming to the objectives, it is for understanding the expanding phenotypic spectrum of NDUFV1 mutations beyond the systemic Lee-like syndromes to isolated optic neuropathy, to explore the mutation type as a driver of organ-specific vulnerability in mitochondrial complex 1 deficiency, and highlight the need for further genotype-phenotype studies and targeted therapies. A 10-year-old female presented with gradual progressive diminution of vision since 3 years with headache on and off with complaints of squint in left eye since childhood. She only had a only had a history of fifth degree consanguineous marriage between parents and left eye anisometric amblyopia in mother. Her ocular examination showed best corrected visual acuity of 6 by 24 in right eye and 6 by 60 in left eye, with the extraocular movements full painless in all directions, with the pupil sluggishly reacting to light with 15 degrees exotropia in left eye, and rest of the examination being normal. Coming to the fundus examination, the bilateral eye showed temporal pallor. And coming to the investigations, GAT is normal and perimetry showed low reliability, and color vision is deficient in both eyes. Coming to the MRI brain and orbit, the mild atropic bilateral optic nerve showing mild stir hyperintense signal and prominent perioptic CSF space. And T1 hypointense and T2 flare hyperintense signal involving the genu of the corpus callosum and forceps minor with small patchy areas of encephalomalacia, which would represent toxic or metabolic etiology. So the lab investigations showed elevated lactate and increased TSH, and G6PD levels were decreased, and normal galactosemia levels were seen, and 17-hydroxyprogesterone levels were elevated. And a complete panel for amino acid, fatty acid oxidation and purine metabolism disorders was done after pediatric referral, and everything came out to be normal. Then we went for whole exome sequencing, where she was found to have an NDUFV1 gene mutation with the transcript NM007103.4 with a variant of C1156C, that is cytosine is repressed by thymine, and so in the protein component, the arginine amino acid at 386th position is replaced by cysteine, and it showed a homozygosity on exon 8 with mitochondrial complex 1 inherited as autosomal recessive. Based on the ACMG classification, it is a likely pathogenic, and the whole genome mitochondrial NGS analysis came out to be normal. And coming to the Sanger sequencing, the patient is found to be homozygous, while the rest of the family, both the parents and the sibling, found to be heterozygous. And this is the electrophoregram sequencing shown, where the variant in the NDUFV1 gene showed a homozygous variant in the proband, where the heterozygous spike is seen in rest of the family. Coming to this is a pedigree chart showing the fifth degree consanguineous marriage with autosomal recessive pattern of inheritance. Coming to the differential diagnosis, this is a confirmed case of mitochondrial optic neuropathy supported by clinical features and NDUFV1 gene mutation. Coming to the treatment, coenzyme Q and riboflavin 10 mg OD were given, and after genetic conservation, idebenone was started. This is an illustration of an inner mitochondrial membrane. In the inner mitochondrial membrane consists of the 5 complexes, and the first complex, third complex and fourth complex were responsible for proton transfer, and the fifth complex shows the production of ATP. And in the inner mitochondrial membrane, where in the complex 1 there will be the NDUFV1 gene, which is the nuclear encoded subunit, which is responsible for this mutation seen in this case. When the NDUFV1 gene mutation was present, there will be a non-functional complex 1, which leads to decreased production of ATP. Then the idebenone is used, and it converts directly to idebenol, which produces ATP. Coming to the literature review, the current case is the first report of optic neuropathy as a predominant phenotype, which expands the clinical spectrum. NDUFV gene mutations are can present as isolated progressive optic neuropathy, And this case highlights the heterogeneous expression of NDUFV1 related mutation type may dictate organ involvement. These are my references. Thank you.
Any other disorder with mitochondrial gene mutation?
Yes, ma'am. There are other genes like even not just NDUFV1 gene. There are other NDUFS gene, and there are iron sulfate gene mutations, and there are also, these are actually nuclear encoded. There are also mitochondrial encoded, like MELAS and everything will come under mitochondrial encoded genes, which would that actually mitochondrial encoded genes, we have to see only the mitochondrial next generation sequencing for such cases. But this is actually nuclear encoded gene. So we went for whole exome sequencing. But in other cases, there will be like MELAS, there will be, there are many, in the complex one also there are genes, other genes which I showed in the picture, NDUFS gene 1, 2, 3, and also nuclear mitochondrial encoded genes will have a mutation.
Okay.